Muscles of gluteal region, abductors and rotators of thigh. Gluteus maximus, inferior gluteal nerve innervation, extends the thigh, especially from flexed position. Assist in lateral rotation of thigh, assist in rising from a sitting position. Gluteus medius, superior gluteal nerve, L5S1, abducts and medially rotates the thigh. Gluteus minimus, superior gluteal nerve, L5S1, abducts and medially rotates the thigh. Tensor fascia lata, superior gluteal nerve, L5S1, abducts medially rotates the thigh. All gluteus medius, minimus, tensor fascia lata, all these three muscles main function is abducts and medially rotates the thigh. Piriformis, branches of anterior rami S1 S2, laterally rotates the extended thigh, abducts flexed thigh. Laterally rotates the extended thigh, abducts flexed thigh. Piriformis, branches of anterior rami, laterally rotates the extended thigh, abducts flexed thigh. Obturator internus, nerve to obturator internus, L5S1, laterally rotates the thigh, laterally rotates extended thigh, abducts flexed thigh. Superior gemellus, nerve to obturator internus, laterally rotates the extended thigh, abducts flexed thigh. Inferior gemellus, nerve to obturator internus, laterally rotates extended thigh, abducts flexed thigh. Piriformis, obturator internus, superior gemelli, inferior gemelli, quadratus femoris. These all laterally rotates the extended thigh, abducts flexed thigh. Pelvic stabilization provided by gluteus medius, gluteus minimus, tensor fascia lata. Gluteus medius, gluteus minimus, tensor fascia lata. These three working on one side antagonizes the gravity on other side. Ask the patient to stand on one limb. The ipsilateral muscles contract to stabilize the center of gravity and maintain a relatively horizontal pelvic position. Ipsilateral muscles contract to stabilize the center of gravity and maintain relatively horizontal pelvic position. Pelvic stabilization is provided by gluteus medius, minimus, tensor fascia lata. During walking, gravity tends to tilt pelvis and trunk to unsupported side. These muscles prevent this unwanted movement by counteracting gravity from opposite side. Paralysis of these three muscles causes pelvic tilt towards the unsupported or contralateral side. This sign is Trendelenburg sign. Paralysis of these three muscles. What are the three muscles? Gluteus medius, minimus, tensor fascia lata causes pelvic tilt towards the unsupported contralateral side. Trendelenburg sign. Trendelenburg test is used to assess hip stability. Sciatic nerve. Sciatic nerve is the thickest nerve in the body. It arises from sacral plexus in pelvis. It passes through the greater sciatic notch below the piriformis muscle. It runs downward and slightly laterally under cover of gluteus maximus midway between greater trochanter and ischial tuberosity and enters back of thigh at the lower border of gluteus maximus. It is descent along the posterior thigh. It is crossed by long head of biceps femoris and divides into tibial and common fibular nerve proximal to knee. Consists of two parts. Tibial nerve formed by ventral divisions of anterior primary rami of L4, L5, S1, S2, S3. Common peroneal or common fibular nerve runs along the fibula bone laterally. Common peroneal nerve divides into superficial peroneal nerve, deep peroneal nerve. Tibial part of sciatic nerve supplies semitendinous, semimembranous, long head of biceps femoris, posterior part of adductor magnus. Sciatic nerve consists of two parts. Tibial nerve, common peroneal or common fibular nerve. Tibial nerve formed by ventral divisions of anterior primary rami of L4, L5, S1, S2, S3. Common peroneal or common fibular nerve runs along fibular bone laterally. Common peroneal nerve divides into superficial peroneal nerve, deep peroneal nerve. Tibial part of sciatic nerve supplies semitendinous, semimembranous, long head of biceps femoris, Posterior part of adductor magnus. Short head of biceps femoris is supplied by common peroneal